Thanks for joining us, Lisa. We're delighted to have you here.
Well, thank you, Dr. Mingle. It's a pleasure to join you and all of our clients and folks here today.
I understand your topic of focus is promoting interoperability. That is the PI category. What are the most important elements you want to bring to our attention about the PI category?
So, first and foremost, I think it's important to call out that there's no new measures in the MIPS promoting interoperability category. And there's also no changes to scoring. Having said that, there are a couple of changes that could impact our clients quite a bit. One of those being the reporting period in 2024 is actually going from 90 days to 180 days. So that could be significant for folks. We have a couple of other changes that I think are pretty minor. There's a modification to the prescription drug monitoring program measure. There's a minor change, more of a clarification and update to the electronic prescribing measure. And then another one that folks need to pay attention to is the SAFER guide is now required. That has been a measure in place for the past 2 years, 2022, 2023. But in 2024, previously they would just say yes or no, whether or not they have completed just the high priority practices guide of the SAFER guide. In 2024, they will have to say yes, that they have done the high priority practices guide. So it's still the same measure, but they do need to complete that. And a reminder that that's in addition to their security risk analysis.
Lisa, just a clarification on that. Are they requiring it to be done or read?
They have to have done the high priority practices guide. In the measure spec, if you click on that, there's a link to the ONC website and it brings you to the worksheet, the checklist, and the associated worksheet that clients can fill out the self assessment guide fairly easily.
Thank you very much. Now, my next question, with the minimum PI reporting period going to 180 days, what effect do you expect that to have on our practices?
Yeah, so I think that's a pretty big change. So I think for anyone who is considering upgrading, changing, or working on some improvements in their program, they need to plan ahead. Because in the past, if they were reporting a 90-day period, if they were changing from one EHR vendor to another, they could report from the old EHR vendor prior to upgrading or work on getting updated and then report from the new vendor. 180 days is a big block of time to report on. So they're going to make sure that they have planned that ahead. Another big piece of this is that there are a couple of measures that are numeric measures where there are exclusions if there are less than 100 patients. So, electronic prescribing or the two health information exchange measures, the sending of health information, the receiving of health information. I know a lot of our practices have been excluded from one or both of those measures because they meet that 100 patient minimum for the exclusion. Um, the exclusion hasn't changed, so now that they're reporting on 180 days, it may be unlikely that they can use that exclusion. So, looking at those numbers, identify, first of all, if they're going to need to report, and then making sure that they are either reporting well or can report at all in those measures.
Do I understand that correctly then that the 100 patient minimum applies to your reporting period?
Yes.
Whether you choose 180 days now or a full year or something in between, um, you're still at 100 patients minimum to exclude from that measure.
Correct.
Okay. Thank you. Now, I understand there's a new naming convention for certification editions. What's that about?
So the ONC has proposed some changes to the certification editions. In the past, we had certification editions that were based on a year. So the 2011 certified edition, 2014, 2015. Right now, we're using the 2015 certified edition Cures Update. What CMS is proposing, based on what the ONC is proposing, going away from those additions and doing a base criteria with regular and ongoing updates. So it's really the Office of the National Coordinator that is overseeing the ONC. Managing and doing those updates. CMS is also trying to get away from within the QPP program of listing out each and every change and really directing people to the ONC site for any changes. We know that that might be hard for folks to follow and understand what they need to do to understand what the rules are, understand that they're in compliance. But that's really pointing towards the ONC to try to manage that versioning and education around that. Hopefully, going forward, that makes it a little easier and cleaner. And I am really hoping that the ONC is able to provide some additional education to help people understand what they need to do to comply.
Thanks, Lisa. And finally, there's always been some practices, some providers who are excluded. Don't have to respond to promoting interoperability. As of the 2024 performance year, who still gets an automatic exception from PI?
And that's a great question, and that's another big piece of the PI program for 2024. As of 2024, it's only clinical social workers who are going to get that automatic exemption as far as provider types. So for 2024, previously there were a large number of provider types that were excluded. So in 2024, no longer excluded are occupational therapists, physical therapists, qualified speech language pathologists, qualified audiologists, clinical psychologists, and registered dietitians or nutrition professionals. So practices really need to take a look at who is set up for MIPS reporting, who's using their electronic health records, and consider that as they're planning ahead. Keep in mind there are still a number of practice types, a number of special statuses that still allow for automatic reweighting. So if you're a small practice, that is a category where you can still continue to get automatic reweighting in the PI program, as well as non patient facing, hospital based, and ambulatory surgery centers. So those are folks that don't necessarily need to report the MIPS PI program. But planning ahead, looking at your options, working with your consultants to try to understand if there's some changes that are impacting you, and whether or not you might want to consider using the hardship exemptions that are continuing to stay in place. But you really do need to have good justification, and we can help you sort that out.
So one of the outs that our clients who might be adversely affected by the change to 180 days, they might qualify for a special exception for that year.
They might. They have to really plan ahead. That came up loud and clear in the final rule with the comments. Um, CMS really is putting the onus on practices to kind of plan that out, but understand that if you do have some issues with your implementation and things get behind, you have some issues with that implementation. Certainly, that hardship exception is an option available.
Well, thank you, Lisa. It's been very informative.
You're very welcome. Happy to assist.